There are a lot of different medical specialties that can do RFA. There are surgeons that do it. There are endocrinologists. There are ENTs. I've even interviewed a pathologist who does it. But the thing about endocrinologists that I think sets them apart is the fact that if you are already dealing with a hormonal disease, and that's what they deal with, if they're treating you with the RFA and then they're helping you manage afterwards thyroid levels at the right level, if you go to an ENT, they can help you with a structural issue. But if you need hormonal support, you're going to then have to go see an endocrinologist. So I think for people with hot nodules, endocrinologists might be a good choice. Who's the best type of doctor to go to? People ask me that a lot. And I always say, I don't think there is a best type of doctor. It really depends on the doctor's experience. My doctor was an interventional radiologist, and he was excellent. I think you can have skills in this and be in a variety of specialties. But if I ask him a question regarding thyroid hormones, he'll say, you need to go to an endocrinologist. I've never seen an endocrinologist. It's interesting how this is kind of moving, evolving into this field of medicine. Not every physician who does thyroid does ultrasounds.
Yeah.
It's actually very common. And I'm like, why is that even the case?
Because
I know.
You can't see.
They should be looking at thyroid glands.
Mm-hmm. Actually, they should be. I agree.
To see what's going on. There's so much you can see.
Yes.
Ultrasound. And I don't understand what I'm looking at, but I know that those who do it every day, they can look at it and see if it's cancer just based on the characteristics.
Right.
Right. So
Yeah.
it's a shame that that's not more prevalent too. Local numbing is really key. The conscious sedation, I think for some people that's vital.
Right.
To help with their anxieties, because some people just really have, some people like that when they go to the dentist. They want to be sedated for dental work. So it's only, I think, only natural that some people might want to be sedated to have a needle put in their neck too. It's easier, I'm sure, if the patient is calm and relaxed for them to do what they're doing. I would imagine if you're hyper and then suddenly you kill the source of the hypothyroidism, your thyroid maybe has to kind of figure out what's going on.
Well, yeah, I think your thyroid wasn't doing its normal thing before because the nodule was messing with it, and now it has to relearn how to work.
In my case, it was 6 months of thyroid medicine to support my thyroid.
So you're not on anything now. Okay, so just your thyroid figured it out after 6 months. Okay, yeah. And I'm the kind of person that wants to have like a mirror on the ceiling so I can see the procedure. And like I've even seen when they took out, because I had fluid in mine, and I don't remember how many cc's it was, but the syringe, it's that big, and it was like this much, filled with like this much fluid. So seeing the procedure, maybe it would be a little freaky if it is on myself and looking up in the mirror.
I think there are some patients that would be very interesting too, and other patients who would use it. So,
actually, I'd want to see the ultrasound. That's what it is. When they're doing the ultrasound, I want there to be a screen on the ceiling so I can see it. Yeah, because then you get to really see what's going on.
Because you can see it kind of like pop.
Oh, you can actually see it. See, that would be neat. You can feel it pop in your.
Yes.
Which I thought was kind of neat.
I thought so too. I actually want to know what it looks like on the ultrasound.
Yeah.
I'm really hoping on Friday.
You get to see it.
I'm really hoping we'll catch one on video because I think that would be so cool.
You're lucky that you get to see it.